Hi, this is Gene Ransom, and I was going to give a quick update on non-compete clauses in Maryland. This should not be considered legal advice. It's for information purposes only. But I must say that I've had quite a few questions lately about non-compete clauses and how they work in Maryland healthcare. Non-compete clauses are in thousands of Maryland healthcare agreements. See them all the time with physicians, mid-levels, all kinds of healthcare folks have these things. These can be fair and reasonable, and sometimes they can put a physician at a severe disadvantage if they want to change jobs. So it's really important if you have a non-compete clause that you understand it and you pay attention to it. And frankly, whenever you're negotiating a contract, you should have a lawyer. Some physicians use these when hiring mid-level employees like nurse practitioners or physician's assistants to protect their practice. Other physicians are required to sign these things when they go work for a large hospital system or another large employer. Typically, these agreements will have restrictions like a geographic area or other restrictions on a physician's future employment opportunities. So the question is, are non-competes legal in Maryland? And the answer is yes, they are. They are legal if they meet certain standards the courts have held over time. In Maryland, a non-compete is legal if it's supported by adequate consideration. That means that there's money involved, that it's ancillary or part of an employment contract, that there's a limit to the area and duration that are reasonably necessary to protect the employer. Usually, this is done in a geographic region or a circumference around the area of work. And then the court would have to rule that there's not an undue hardship on the employee or that it is against public policy. And that's kind of the standard the courts have used to determine whether or not they've been upheld in Maryland. Several years ago, the General Assembly in Maryland did revoke the ability of employers to give low wage employees non-competes. And that's very low wage employees, non-competes. But obviously, for healthcare workers and physicians, non-competes are enforceable and you should take them seriously. Don't just think because your buddy in a bar said, well, those are always thrown out, that that's the case. I have heard of non-competes being enforced, and I have heard of them causing issues for all kinds of healthcare workers and other workers who left and decided they wanted to go somewhere else and had restrictions on what they couldn't do. Typically, the state of Maryland or the court system in Maryland will enforce a non-compete because they want to make sure the former employee couldn't misuse trade secrets or client list. And they also want to make sure that the former employee would be providing a unique service. Maryland courts will use the blueprintial approach, which means they'll strike unreasonable provisions of a non-compete, whereas some other states might have rules where they just strike the whole clause if there's unreasonable provisions. The key to these agreements is they have to be reasonable. You can't have a radius around the employee of 300 miles and argue that's reasonable, but a 10-mile radius around where you worked is a very reasonable, enforceable non-compete. And if you think about Baltimore City, if you're working in one of the hospitals, it could really cause you a problem. If you want to stay in another city hospital, you might have to leave the Baltimore area. So again, if you have one of these clauses, if you're doing any contract, get a lawyer. All right. So things you should consider when you're negotiating on non-compete language. First of all, anything, again, get a lawyer. If you don't know who to use and you're a physician, you can always call MedChi, the Maryland State Medical Society, and they can help you find somebody. Remember that every state is different, and the lawyer you use to help you negotiate needs to know that rules in Texas may be different than Maryland. In fact, the District of Columbia bans many non-compete clauses and has a much more restrictive statute than the state of Maryland does. So just crossing over into the District of Columbia can make a difference. Every state has a different set of codes, rules, and case law in effect. So it's really important that A, you think about the future and whether or not you can live with it, and B, you get solid legal advice. Again, we've had increasing questions. There's been a lot of debate about this. Recently, the Federal Trade Commission issued a ruling banning some non-compete clauses. The proposal, which has not been finally approved yet and has had a lot of controversy, actually doesn't apply to nonprofits. And every hospital in Maryland is a nonprofit, and many healthcare facilities are nonprofits. So it's really important to understand what's going on and what things are changing. And again, If you need help in the state of Maryland and you're a physician, you can always reach out to MedKai and they can help you out. So that is a quick and dirty overview of non-competes in Maryland. And I would again just remind you, this is for information purposes only. It should not be considered legal advice. And please reach out to MedKai, the Maryland State Medical Society, if you need help on non-competes. Thank you so much.